Welcome to Sonia Podcast. So I'm going to tell y'all 6 reasons you might have thigh pain. And I'm going to tell you what some doctors actually says. I'm doing medical. Part of my podcast is going to be medical because my supporters asked me if I can do medical, and a lot of them, I always tell y'all, I have great supporters. So someone gave me this, so I told them yes, I'll do it. As long as it has the MDs or y'all know I always do mental health, but the physicians, if it's coming from any medical center or university, then I can actually do it. It just have to have some medical proof where I can say this because, I don't want to have no disclaimer where I'm saying something that I have no medical proof. So I do all the research for this medical stuff before I can actually give it to y'all. I make sure the research is done. So it says, close up of women grabbing her thigh. It goes without saying that your thighs play a pretty huge role in helping you move around through both daily tasks and tough workout. So it can throw you for a serious loop when you find yourself suddenly struggling with thigh pain and wondering, why do my thighs hurt? For the average person, thigh pain is not uncommon, said Mark Conroy, MD, emergency medicine and sports medicine physician at Ohio State University Wexner Medical Center, and for athletes is even more likely to happen. Prevalence aside, though, if your upper legs are leaving you feeling lousy, you're likely eager to figure out what the F is going on. In this can help you do just that. Ahead, experts explain 6 potential causes of thigh pain and remedies for each, so you can get back to moving and grooving. First, a bit about your thighs. Given that you're currently doing some online sleuthing as thigh pain cause and remedies, you probably have at very least a solid idea where your thighs are on your body. But what about the specific thigh muscles, and what do they do? The thigh, aka upper leg, contains several muscles which allow the lower body to bend, flex, and rotate, according to the Cleveland Clinic. To make things sort of easy, the thigh muscles can be grouped based on their functions and locations. Adductors, which allow you to bring the thighs towards each other. Quadriceps, which are responsible for making sitting and standing fairly seamless. Hamstrings, which allow you to extend your hip to move your leg behind your body, such as you're walking, and to bend your knees, such as when squatting. Pestus, which lets you flex and rotate your thighs at the hip joint. Each of these groups have multiple muscles within them, making up plenty of areas that you can strain, bruise, stretch, or otherwise injure. Tendinitis is inflammation or irritation of a tendon. One of the thick fibrous cords that attach muscles to bones, according to the Mayo Clinic. It can technically occur in any of your tendons. But when it comes to your thighs, it tends to impact 2 spots. The hamstring, which contains 3 muscles that run down the back of your thigh, or quadriceps, which include 4 muscles that span the fourth of your thighs. Hamstring tendinitis is an overuse of the hamstring muscle, said Mark Slangberg, MD, a board-certified sports medicine physician at Mercy Medical Center in and around Baltimore. For quadriceps tendinitis, both causes can cause such uncomfortable symptoms such as dull, achy feelings when you move your leg, tenderness when you move, and mild swelling, usually high up near your butt or down the back of your thigh near your knee, explained Dr. Corn. This tends to be an overuse injury. It's not something that develops suddenly, he says. Usually you have a pain that progressively worsens over time. A good example, after weeks of going hard at the gym, you start wondering, why do my thigh hurt? How to treat thigh pain, because hamstring tendonitis is usually tied to using your hamstring muscles more than usual. Take a beat to think about the exercise or activities you've been doing lately that could have caused it, and then scale back, suggests Dr. Conroy. So if you've been training for a 5K, it may be a good idea to rest for a little bit. Every situation is different, but it's a good idea to give it a day or two and ease back into your exercise. Listening to your body along the way, rest, stretching, ice, and heat are also always helpful, he adds. NSAIDs, non-steroid anti-inflammatory drug, can also be helpful for relieving inflammation and easing any discomfort, said Jason P. Warmack, MD, Chief of the Division of Sports Medicine, Associate Professor in the Department of Family Medicine and Community Health at the Rutgers University Robert Wood Johnson Medical School. While it's always a good idea to speak to. While it's always smart to speak to your doctor before trying any new meds, Dr. Warmack recommends taking the NSAIDs when thigh pain strikes as directed on the label. If your discomfort doesn't get better after a week or so, reach out to your doc for evaluation and the possibility of a referral to physical therapy. 2. Muscle strains. A muscle strain, aka pull muscle, happens when one or several of the muscles in your thighs get stretched too far, said Dr. Conroy. This can happen if you go harder than you usually do or you haven't warmed up enough, he said, adding that it usually seems in the quadriceps of hamstrings. There are unfortunately plenty of ways you can pull in muscles in your thighs, but you're more likely to do it when you're suddenly amped up the intensity of an exercise, such as doing sprints, when you haven't run fast in a long time, or pushing yourself too hard doing leg lifts. This type of thigh pain can come on more suddenly than tendonitis and may feel like a cramp in the back or forth of your thigh. Depending on which muscles is impacted, said Dr. Conroy, it's pretty tender at that moment and lessens after that. How to treat thigh pain. Resting your muscles might very well do the trick if you're dealing with a pulled muscle, said Natasha Trinacosta, MD, sports medicine specialist and orthodontic surgeon of Citizen Institution in Los Angeles. Most of the time, with muscle strains, it will be resolved over time, she said, meaning you should progressively feel better over a few days and may feel good as new after a week. Stretching and ice in the area can also help with the cramping and pain, asked Dr. Conroy. Exact stretches depend on where exactly you pull a muscle, but lifting your leg up in the air until you feel a stretch, either with a strap, your hand, or resting it on a flat surface such as on a wall, can help you hamstrings. And grasping your ankles and gently pulling your heel up and back until you feel a stretch in the front of your thigh can stretch your quads. Doing these once or twice a day along with ice should help, said Dr. Conroy. 3. Trauma. When it comes to cause of thigh pain, trauma can refer to a range of reasons, from bruising your leg after running into a corner of your bed to actually tearing something internally. If you hit your leg on something, there's usually a throbbing pain in the area that you struck, which can last for a day or two, said Dr. Conroy. But if you tore something, you might have actually felt a tearing or popping sensation that was immediately followed by some muscle weakness and difficulty putting weight on your injured leg. How to treat thigh pain. The exact type of treatment depends on the intensity of the trauma. Simply bruising your upper leg might warrant just ice in the area to prevent any swelling before it starts and alleviate any pain. It might also call for taking an NSAID and again refer to the product label for specific directions, said Dr. Conroy. But if you suspect that you actually torn a tendon, which will cause symptoms such as significant swelling and bruising, you'll need to be seen by a doctor for treatment, said Dr. Trinacosta. They'll likely run some imaging tests to determine the extent of the tear, and in some extreme cases may need to perform surgery to repair the damage. Essentially, a a symptom, thick pain, or an injury or irritation of the sciatic nerve, which is the largest nerve in your body that runs from the base of your spine through your lower leg, according to the U.S. National Library of Medicine. This nerve controls muscles in the back of your knee and lower leg and allows you to have feelings in the back of your thigh, part of your lower leg, and the sole of your foot. In addition to pain, sciatica can also cause weakness, numbness, or tingling that starts in your lower back and extends down to your leg. It usually happens on one side of your body, said Dr. Womack. It can even travel down as far as your calf, foot, and toes, or radiate into the front of the thigh. He notes there are a bunch of different reasons why you might suffer from sciatica, including a ruptured disc in your spine, narrowing of the spinal canal, and an injury such as pelvic fracture, all of which can cause thigh pain and put pressure on the nerve. How to treat thigh pain if you think the cause of your thigh pain is in fact sciatica. You should schedule a visit with your doctor, as they'll be able to determine the best course of treatment, which typically begins with the least invasive method available, said Dr. Womack. That means recommending remedies such as NSAIDs and muscle relaxants to address the pain from muscle spasm related to nerve irritation, along with physical therapy to try to take pressure off the nerve. If a patient is still not better after that, they may need an MRI to see if there's something pushing against the nerve, said Dr. Wall. If there is anti-inflammatory medication, OTC, or prescription, depending on your pain intensity, and even surgery may be needed to fix the issue. Number 5, blood clog. A blood clog is a mass of blood that forms when platelets, protein, and cells in your body stick together, according to the NLM. They are normal under certain circumstances, things to help you stop bleeding when you get a cut. But blood clots can potentially form where they shouldn't, such as when you're not injured due to, say, a lack of movement, such as post-surgery or while traveling a long distance, and can be dangerous and cause thigh pain, among other health issues. Deep vein thrombosis, for example, is a blood clot that forms in a deep vein, usually in your leg, that can cause throbbing, aching pain if the clot breaks loose, and can travel through your bloodstream and get stuck in your lungs, blocking blood flow and leading to serious health complications, according to the Mayo Clinic. So if you're wondering, why do my thigh hurts, survey your symptoms. Swelling, redness, or discoloration of the skin and feeling of warmth can all hit of a blood clot. It might also feel like cramping or a deep ache in the legs, said Dr. Womack. How to treat thigh pain. Blood clots are serious and you need to be seen ASAP if you suspect you might have one, which is why Dr. Womack suggests going to the emergency room, where you'll probably be given an ultrasound of your thigh to try to spot the clot. From there, you're likely to treat with blood thinning medication, such as warfarin, to try to break up the clot, and be monitored for several days, depending on how severe the clot is and how well the medication works, he said. Parasitica said that 5 times fast is characterized by tingling, numbness, and distinct pain in your outer thigh, according to the Mayo Clinic. It's typically a burning feeling on the front and outer side of your thigh, notes Dr. Conroy. It's caused by compression of the lateral femoral cutis nerve, which provides sensation to the skin covering your thigh. While it might be super uncomfortable, this condition doesn't affect your ability to use your leg muscles. Unfortunately, however, something as simple as wearing tight clothes, belts, corsets, skin-tight pants, or being pregnant can lead to Maria prostatica. It can also be caused by weight gain and scar tissues in the area outer thigh due to injury or previous surgery, according to the Mayo Clinic. How to treat the thigh pain in many cases. Maria prostatica can be relieved by wearing more loose-fitting apparel and getting up and moving more often, said Dr. Conroy. OTC pain relievers such as Tylenol and NSAIDs can also help address your upper leg aches. And if those doesn't help, your pain is severe and your symptoms are lasting for more than 2 months, your doctor may recommend a cortisone steroid injection to reduce inflammation, or antidepressants or anti-seizure medications to prevent pain relief, according to Mayor's Clinic. If you're having thigh pain that won't quit, doctor says it's important to get it checked out. The most concerning thigh pain is sharp pains, particularly ones that doesn't resolve in 24 to 48 hours of pain that associated with limping, explained Dr. Trinacosta. If you're not able to walk normally because of your thigh pain, you need to seek care. You also shouldn't hesitate to consult a doctor if your discomfort just isn't getting better, despite trying relief methods such as stretching and icing. As Dr. Womack, after all, reaching out for help from an expert is also a good idea. So, that was a lot. But thank you. Thank you, my supporter. Oh my God, that was a lot. For the information on the 6 thigh pains, I really appreciate it. Please give this a 5-star review on Spreaker, Spotify, Apple, wherever the podcast at. Please share. Please leave a comment on this podcast as sv76675@gmail.com. You can go to my website, http://podcasters.com/wordpress.com, www. Instacart 156 www.avio. Use promo code 156. Use promo code Sonya. You can follow me at SON.IA, Instagram, Sonya Santiago, Twitter, Sonya Santiago, Pinterest, Sonya Santiago, Facebook, and have a great night.